Thank you, Mr. President. Mr. President, I'm honored to be joined here today with my distinguished friend and extraordinary colleague, Senator Harkin of Iowa, to support continued funding of the Prevention and Public Health Fund. And he has been a leader in this area, so I'm particularly privileged to stand with him today on behalf of a fund that is absolutely necessary to address prevention of serious and chronic diseases, and it is fiscally and morally absolutely essential that we approach healthcare in this way. I'm going to ask for permission to continue to speak. I'm not sure what the allotted time is. If there's no objection, I would ask for time at least through 5 o'clock for myself, Senator Harkin, and others who may join us in this colloquy.
Without objection.
Our nation currently spends 75 cents of every dollar on health care for the treatment of preventable conditions. These diseases can be stopped and prevented in people through simple, common sense measures, and yet a meager 3 cents of every dollar goes toward those treatments, therapies, and practices that can help prevent the diseases that are so wasteful to our economy and to individuals and their livelihoods. Our young people are on track to be the first generation of Americans to live a shorter, unhealthier life than their parents. The responsibility to change the course of this history is in our hands. One step that this body, led by Senator Harkin, has taken was to establish the Prevention and Public Health Fund. It's the only dedicated federal fund for the prevention and improvement of our nation's public health. Prevention is the most effective way to improve the health of Americans while reducing healthcare costs in the United States. This funding supports efforts to reduce the rate of infant death, cancer, diabetes, heart disease, and tobacco use. They are the killers, and they kill unnecessarily and avoidably. Sadly, many Connecticut residents suffer from those very chronic diseases. 30% of Connecticut residents have high blood pressure. 9% have diabetes. 21,000 residents of Connecticut are diagnosed with cancer annually, and 16% still use tobacco. The Prevention and Public Health Fund invests in a broad range of evidence-based activities, not speculative, not abstract, conceptual, theoretical, evidence-based activities, including community and health prevention initiatives that can help stop all Americans from developing debilitating and chronic disease in the future. So far, grants from this fund were awarded to support 4 Connecticut projects, including on mental health and addiction, diabetes management in older and disabled adults, and the establishment of an electronic birth registration system to improve the ability to track health and well-being of infants. It sounds pretty rudimentary, and it is, using technology to track health and well-being in infants. The Center for Disease Control and Prevention has a hard-hitting anti-tobacco media campaign funded from this fund, focused on the destructive health effects of smoking, and it is not only effective, but it is supported by the efforts that we've advocated on preventive health management. Over the next 3 years, this campaign is expected to save the country $170 million in non-incurred health costs and lowered productivity that results from smoking. The CDC has estimated that this campaign will assist 50,000 tobacco users to quit smoking. I know from my own work in suing the tobacco companies, establishing a fund to support exactly these kinds of efforts, that millions of Americans across the United States want to quit. They try repeatedly. 99%, I think, of all smokers want to quit, and almost all try to quit, but quitting is hard because nicotine is one of the most powerfully addictive drugs known to man, and cigarettes are a powerfully effective nicotine delivery tool. These 50,000 tobacco users who quit smoking are better off, not only their health, but their pocketbooks. They save countless dollars that they'd otherwise squander on smoking or tobacco products. And they are healthier, their families are happier, and they save themselves from lifetimes of addiction and disease. And the preventive efforts of the CDC as a result of this fund are preventive in stopping young people from beginning to smoke as well. It is monumental, it is historic, it is a fund that should be fully supported by this Congress. The fund afforded the CDC the ability to run another tobacco education campaign called Tips from Former Smokers. According to a recent study, this campaign led 1.64 million Americans to attempt to quit smoking. Those who have completely quit smoking as a result of this campaign added 500,000 quality-adjusted life years to the United States population. I know these numbers sound abstract and abstruse. They are real lives, and they've been saved from the evils of tobacco addiction and smoking, which in turn cause cancer, heart disease, all kinds of preventable diseases. This funding is essential to running the local departments of public health in many areas of our nation. Workers at those departments of public health are at the forefront of preventing infectious diseases, an issue that most recently has come into focus as part of the domestic Ebola response. Without adequate funding for these departments, the people most closely tasked and most immediately responsible for providing services and information to people in a time of crisis may be unable to respond when communities are most in need of them. We must change our healthcare focus from sickness and disease to wellness and prevention. We grew up, many of us, with our mothers telling us that an ounce of prevention is worth a pound of cure. Mr. President, that is not only an adage that is commonly repeated, it is commonly proved in everyday life. I strongly encourage my fellow members to support the Prevention and Public Health Fund to help ensure the future well-being of our fellow citizens.